The piercing scream echoed through Colorado's Rocky Mountains as Jake Wilson, an experienced hiker, plummeted 30 feet down a remote cliff face. His leg twisted grotesquely on impact, bone protruding through skin, blood staining the rocky ground beneath. Mike Carson's head snapped up at the sound. The former Delta Force combat medic had been enjoying a solitary hike, his first weekend off since starting a civilian paramedic job. 20 years of Special Forces training kicked in as he instantly calculated the direction and distance of the scream. Help! Oh, God, he's bleeding badly. A woman's panicked voice carried on the wind. Mike's practiced eyes scanned the terrain, spotting a small group of hikers gathered at a cliff's edge about 200 yards away. He broke into a tactical run, his military-ingrained situational awareness noting potential hazards and the quickest approach route. Reaching the scene, Mike found 4 hikers huddled around their fallen friend. Jake, mid-30s and well-equipped, lay conscious but pale, his breathing rapid and shallow. Blood pooled around his shattered leg, and his abdomen showed the telltale signs of internal bleeding Mike had seen too often in combat. "I'm a combat medic," Mike announced, kneeling beside Jake. "Everyone step back and give me space." His quick assessment revealed the grim reality. Compound tibial fracture, possible internal injuries, and they were 6 hours from the nearest medical facility. The rocky terrain made helicopter evacuation impossible. One of the hikers held up her phone. "No signal. We've been trying for 10 minutes. Mike checked Jake's pulse, rapid and weak. The sun would set in 4 hours, and storm clouds were gathering. Time was running out, and Mike knew he had only one option, one that would push his military medical training to its absolute limits. Mike's trained hands moved methodically over Jake's body, cataloging injuries with a precision drilled into him through countless battlefield assessments. The compound fracture was the obvious threat, but his combat experience screamed that there was more. Rigid abdomen, bruising pattern consistent with internal bleeding, Mike muttered, recognizing signs he'd seen in Afghanistan. Possible splenic rupture. The parallels to a mountain ambush victim he'd treated near Kandahar were unnervingly similar. Jake's eyes fluttered, consciousness wavering. "Can't feel my legs," he gasped between rapid, shallow breaths. Mike noted the growing anxiety in the other hikers' faces as they watched their friend deteriorating. "Listen up," Mike addressed the group, his voice carrying the calm authority that had steadied countless soldiers. "I'm going to be straight with you. Jake has life-threatening injuries. Without immediate intervention, he won't survive the 6-hour trek to medical care." Thunder rolled in the distance as dark clouds gathered overhead. The temperature was dropping, and Mike could smell rain coming. Weather, always a wild card in mountain rescue operations, just like in his Special Forces days. "What do you have in your packs?" Mike asked, mentally cataloging resources. The group produced basic first aid kits, water bottles, some energy bars, and various pieces of hiking gear. His own pack contained his personal medical kit, more advanced than civilian standard, but far from a combat medical bay. Sarah, a nurse among the hikers, spoke up, "I have some medical supplies, but nothing for injuries as severe." Her voice trembled slightly, understanding the gravity of the situation. Mike pulled out his military-grade multi-tool and tactical flashlight. His mind raced through the improvised medical procedures he'd learned in Special Forces training. They had paracord, clothing that could be repurposed, alcohol-based hand sanitizer, and a lighter. Not ideal, but he'd worked with less in combat. The wind picked up, carrying the first drops of rain. Jake's skin was becoming clammy, his pulse thready, classic signs of advancing shock. Time was running out. "We need to make some hard decisions," Mike announced, his mind already formulating a plan that would draw on the darkest chapters of his combat medicine experience. "I've dealt with similar injuries in combat zones. There's a way, but it's risky, and I'll need your help." He looked each hiker in the eye, evaluating their stability and potential usefulness, just as he'd done with young soldiers in crisis situations. "What I'm about to attempt will be considered extreme in any civilian context, but right now it's Jake's only chance." The group fell silent, the gravity of the situation settling over them like the approaching storm clouds. Mike began unpacking his medical kit, his movements precise and purposeful. His mind flashed back to his Special Forces medical instructor's words. In the field, sometimes the only right choice is the impossible one. Thunder cracked overhead as Mike laid out his improvised surgical tools on a clean bandana. The other hikers watched, a mixture of horror and hope on their faces, as they realized what their mysterious rescuer was preparing to do. "I need to know you're all with me," Mike said firmly, his voice cutting through the wind. "What happens in the next hour will determine whether Jake lives or dies. I can't do this alone." The group exchanged glances, then nodded one by one. They had no choice but to trust this stranger who carried himself with such quiet confidence, whose hands promised both violence and healing. Mike's mind flashed back to his Special Forces medical training in North Carolina. The instructor's voice echoed in his memory. "When you're miles from help, you become the hospital." He'd practiced these procedures countless times in simulated combat conditions, but performing them on a mountainside with improvised equipment was another matter entirely. "Sarah, you said you're a nurse?" Mike called out while sterilizing his multi-tool with hand sanitizer and flame. "I need you as my primary assistant. The rest of you, gather every clean piece of clothing you have. We need bandages." Rain began falling steadily as Mike laid out his plan. "Jake has internal bleeding and a compound fracture. We need to stabilize both before we can move him. I'm going to walk you through a modified combat casualty procedure." His hands moved with practiced efficiency as he cut away Jake's pants leg. "Tom, hold this flashlight. Kevin, I need you to create a wind barrier with emergency blankets. Emily, start tearing those t-shirts into 3-inch strips." Mike pulled Sarah aside, speaking in low tones. "I'm going to perform an emergency fasciotomy to relieve compartment syndrome, then reduce and stabilize a fracture. I need you to monitor his vitals and assist with bleeding control. Can you handle that?" Sarah nodded, her professional training overcoming her initial shock. "Just like or nursing, but dirtier?" "Exactly." Mike managed a grim smile. "We're going to use some unconventional techniques I learned in Afghanistan. When supplies are limited, you adapt." Mike retrieved a small bottle of wilderness water purification tablets. "These contain iodine. Not ideal, but it'll help sterilize the wound." He began cleaning the area around Jake's compound fracture, his movements precise despite the rain. "In Special Forces, we had a saying," Mike explained while working, keeping his voice steady to calm the group. "Improvise, adapt, overcome." Today, that's not just a motto. It's Jake's survival plan. Using his tactical flashlight's beam, Mike identified the key anatomical landmarks. The procedure ahead would require all his combat medical training. He performed similar surgeries in dusty forward operating bases and mountain caves, but those had been on soldiers prepared for combat risks. "Jake," Mike spoke clearly to his semi-conscious patient, "I need to do an emergency procedure. It's going to hurt, but it's necessary to save your leg and your life. Do you understand?" Jake managed a weak nod. Mike turned to his makeshift surgical team. "We'll use the climbing rope for a tourniquet. Sarah, when I tell you, release it in controlled intervals. The rest of you, hold him steady." The next 45 minutes tested every skill Mike had learned in his military career. He worked methodically, using his multi-tool with surgical precision, periodically calling out vital sign checks to Sarah. The other hikers followed his instructions with military-like discipline, their shared purpose overcoming their fear. "This is how we stabilize fractures in mountain combat operations," Mike explained as he fashioned a splint from trekking poles and climbing webbing. "The principle is to immobilize above and below the injury site." The impromptu surgery drew on every aspect of his Special Forces medical training. He used paracord as surgical suture, sterilized with alcohol and flame. The water-resistant backing from a map became a sterile field. A camelback tube transformed into a surgical drain. In combat medicine, you learn to see beyond an item's intended purpose, Mike explained while working. Everything becomes a potential medical tool. He demonstrated this philosophy by converting a space blanket and hiking poles into a protective surgical tent as the rain intensified. Throughout the procedure, Mike maintained a running commentary, partly to keep his team informed and partly to keep Jake conscious. He explained each step in civilian terms, translating his combat medical experience into something his impromptu assistants could understand and execute. "This is similar to what we did for blast injuries in mountains of Afghanistan," he said, showing Sarah how to monitor the facial compartment pressure. "Different cause, same principles. The body doesn't care if it's a bullet or a boulder. Tissue is tissue and blood is blood." As Mike completed the final sutures, using careful surgeon's knots learned in combat hospitals, he allowed himself a moment of cautious optimism. The color was returning to Jake's extremities, and his vitals were stabilizing. The impossible procedure, born of battlefield necessity and executed with civilian tools, appeared to be working. The next crucial moments would determine whether Mike's unprecedented wilderness surgery would save Jake's life. Rain pounded against the makeshift surgical tent as Mike monitored his patient's vital signs, his special forces training keeping him focused despite exhaustion setting in. "Blood pressure stabilizing," Sarah reported, her voice steadier now. "But his temperature is dropping." Mike nodded grimly. "Combat medicine priority. Prevent the trauma triad, hypothermia, acidosis, and coagulopathy." He quickly organized the group into a patient warming team, implementing techniques he'd used in high-altitude rescues during his military service. Suddenly, Jake's body went rigid, his back arching. "He's crashing," Sarah called out, panic edging into her voice. Mike's combat medical training took over completely. "This is like the Kandahar Ridge extraction," he muttered, moving with practiced precision. "Multiple trauma, delayed shock response." His hands moved automatically, implementing battlefield medicine protocols that had saved countless soldiers. "Everyone quiet," Mike commanded, his voice carrying the unmistakable authority of a combat veteran. He pressed his ear to Jake's chest, listening intently while counting seconds. The other hikers held their breath, rain drumming against emergency blanket shelter. "Tension pneumothorax developing," Mike diagnosed, recognizing a complication he'd seen too often in mountain combat injuries. "We need to relieve the pressure now." Without hesitation, Mike reached for his tactical pen, a tool that had saved lives in combat zones before. "In the field, you use what you have," he explained, his voice calm despite the gravity of the situation. "Sarah, prepare that alcohol wipe." The next 60 seconds demonstrated why Special Forces combat medics undergo such intense training. Mike's movements were precise, decisive, and swift, skills honed through years of performing emergency procedures under fire. "Come on, Jake, stay with us," Mike urged as he completed the procedure. For 10 seconds, nothing happened. Then Jake gasped, his oxygen saturation immediately improving. The other hikers released their collective breath. "In combat medicine, we call this the golden moment," Mike explained, monitoring Jake's rapidly improving vital signs. "When everything you've trained for comes together to save a life." The storm intensified outside, but inside their makeshift medical shelter, the atmosphere had shifted from desperate crisis to cautious hope. Mike continued his methodical monitoring, employing the same patient surveillance techniques he'd used in combat hospitals. "Your leg stabilized, breathing's better, and the bleeding's controlled," Mike told Jake, who was now fully conscious and remarkably stable. "You're not out of the woods yet, but you got the fighting chance we needed." Jake grabbed Mike's wrist weakly. "Thank you," he whispered. "I thought I was dead." Mike smiled slightly, the same smile he'd given to wounded soldiers in distant battlefields. That's what everyone says until a combat medic shows up. His attempt to humor masked the profound professional satisfaction of another successful crisis response. The other hikers watched in amazement as Mike officially organized the next phase of the rescue. His military training was evident in every aspect, from the way he delegated tasks to his constant situational awareness. "In Special Forces, we learned that saving a life is only the first step," Mike explained as he prepared Jake for transport. "Now comes the equally critical challenge of evacuation." Looking at his patient's stabilized condition, Mike allowed himself a moment of reflection. This was why he'd endured years of the military's most demanding medical training. Not just for combat scenarios, but for moments like this, where those same skills could save civilian lives in desperate circumstances. As the storm cleared, Mike supervised the construction of an improvised stretcher using backpack frames and climbing rope, demonstrating techniques perfected in Afghanistan's mountains. The next few hours are critical, Mike instructed as they prepare to move. We'll rotate carriers every 15 minutes, just like military casualty transport. Slow and steady wins this race. The descent took 4 grueling hours. When they finally reached cell service range and emergency services arrived, the first responders were amazed by the sophisticated field intervention. At the hospital, the trauma surgeons were stunned. In 20 years of emergency medicine, I've never seen a field surgery of this caliber, the lead surgeon admitted. Your military training saved not just his life, but his leg too. Mike deflected the praise with characteristic military humility. The real heroes were the civilians who stepped up. It proves that with proper guidance, ordinary people can do extraordinary things in a crisis. 2 months later, Jake was recovering remarkably well. He'd started taking wilderness first aid courses, determined to pay forward the gift of life he'd received. Mike showed me that knowledge is the difference between helplessness and hope, Jake reflected. This incident raises important questions for all outdoor enthusiasts. How prepared are we for wilderness emergencies? What basic medical skills could make us valuable in a crisis? The story of Mike and Jake reminds us that the skills that save lives in combat can save them on our weekend adventures too. Have you ever encountered an emergency situation while hiking? What skills do you wish you had in that moment? Share your story in the comments below. Your experience might help others prepare better for their outdoor adventures. For those inspired by this story, we'll be featuring more wilderness survival tips from military veterans in upcoming videos. Don't forget to subscribe and hit the notification bell to learn potentially life-saving skills from those who've mastered them in the world's toughest conditions. Remember, every like and share helps spread these crucial survival lessons to fellow outdoor enthusiasts. Together, we can build a community better prepared for wilderness emergencies. Stay safe on the trails, and as Mike would say, train like your life depends on it, because someday it might.